I would like to thank you for inviting me to speak here today. The topic of my talk is the prodromal features and carriers of Gaucher disease. I work at the Gaucher Clinic in Shaare Zedek in Jerusalem. These are my disclosures. Now, Parkinson's disease starts as many as 10 to 15 years before the typical motor signs appear, a period of time known as the prodromal stage. These symptoms are the interest of my talk, and the diagnosis of Parkinson's disease is usually done when the motor symptoms appear. And eventually, in the later stages of Parkinson's disease, we have dementia and other typical signs. Now, prodromal Parkinson's disease is a series of signs and symptoms that indicate a higher than average risk of developing Parkinson's disease in the future. As you can see at the prodromal stage, we have loss of smell, we have depression, later on rigidity and bradykinesia, which are the motor symptoms, and at the last stage is dementia, gait, etc. Now, as part of our prodromal study, we decided to use some of the tests used by the MDS Movement Disorder Society to characterize prodromal Parkinson's. And with the help of Dr. Arkadir, a movement disorder specialist who works with us on this project, we added other user-friendly and measurable tests. And we decided to exclude invasive testing in order to make the study accessible to a larger cohort. We chose the test to cover the 5 categories we defined: the anatomy category, sleeping disorder, motor evaluation, and cognitive and mental. And the last is the genetic domain. We sequence the GBA gene and other genes associated with Parkinson's disease, and we keep the blood for future biomarker analysis. Now, the topics of my talk will be: 1, to present some of the tests that we perform; the second, to show some of the results of the first cohort that we have analyzed; and the third is to show our future plans. So the first test we perform is a hyperechogenicity of the substantia nigra, which has shown strong associations to Parkinson's disease. Mariana, ultrasound specialist, performs this test. This is an area in the brain where neurons normally produce dopamine, which control patterns of movement. When these neurons are damaged or destroyed, dopamine levels drop and normal signaling is disrupted. But only when there are 60 to 80% of the neurons that have been destroyed, only then the motor symptoms appear, which means it might be a too late a stage to try and salvage any functional neurons. If we compare controls, which are the black lines, to, when I say controls, I mean no Parkinson's and no Gaucher, to Gaucher patients, we see that the Gaucher patients have a higher echogenicity score. If we compare the same group of controls to GBA carriers, we see the same trend. And when we compare the GBA carriers to the Gaucher patients, we see that both of them have a higher echogenicity area. And this paper was published by our group in 2019. Another test we perform is the NeuroTrax, a cognitive computerized test evaluating memory, attention, etc. A test which was used as part of the Gaucher patient study in 2005. The scores are given for each test separately, and there is a global score as well. We use the color discrimination test, which evaluates slight differences in color shades. We use the smell test. We use the upset smell test, which is 12 smell version to test decrease in smell. We use a MoCA evaluation, a cognitive assessment that includes tests for short-term memory, attention, orientation, clock drawing, etc. And this test is used to evaluate patients in neurologists' clinics. We use some motor evaluation tests. One of them is the Purdue pegboard, a test to measure movements of the fingers, hands, and arms in 4 different tests, each lasting 30 seconds, showing motor ability. And the iTug, which is a timed up and go, a simple test performed by a mobile phone placed on a subject's chest, recording the axis positions while a person walks 10 meters, sits, and turns around. Measuring retinal thinning may be an early sign of Parkinson's disease, a thinning which is also shown in Gaucher patients. So we perform an OCT test, an optical coherence tomography, to measure the different layers of the retina to assess the thickness of each level. And in the study we performed in collaboration with the eye department in Shaare Zedek, we compared Gaucher patients to GBA carriers and control, and we show a significant thinning of the RNFL layer in the retina of the Gaucher patients compared to controls. So this study is part of my PhD thesis I'm doing in the School of Public Health in Jerusalem, in the Hebrew University, and the aim is to define the prodromal features of Gaucher disease. My first objective is to determine the frequency of prodromal features in carriers of Gaucher disease compared to non-carriers. The second is to determine the normal values for some of the tests that we have added to the MDS and do not have normal values. And the third is to build a statistical model to determine the risk of Parkinson's disease in carriers. So I am going to show you the first 98 carriers that were sequenced and studied. So the median age is 51, and it ranges between 40 and 74. 57 were female. If we're looking at the mutations, 67% carried the N370S mutation, the milder mutation that has shown less association with Parkinson's versus the severe mutations. And 25.5% of carriers had at least one family member with Parkinson's disease. And in 2006, our group showed an increased incidence of Parkinson's in relatives of Gaucher patients. So the next slide, I present the tables with results of our analysis of the 98 carrier cohort. In each category, we present the most abnormal tests found. Each test is presented on the left. Then we have the cutoff from the literature, if it exists, showing the median and range from our cohort and the percentage of abnormal testing. So if we look at the anatomy domain, we can see that the ultrasound of the brain shows a higher abnormal testing, 18.5%. Also the upset smell test and the urinary and erectile dysfunctions too. We look at the cognitive and mental, and we've had the MoCA as a total score, and we also had subgroups of the MoCA, and we can see that in both we have the MoCA is a high frequency of abnormality, also some of the neurotracts testing, and some of the Beck depression. Okay, if we're looking at the sleeping disorder, then both of the tests that we have used have showed a higher percentage of abnormality testing. And if we're looking at the motor evaluation, we see that there's a higher percentage of UPDRS3 abnormal testing. Okay, now we look at the associations between the different testing. And as you can see, if we association with gender, the ultrasound of the brain shows a higher incidence in male. The neurotracts, part of their subgroups, show it as well. And you can see a higher percentage of depression in female. If we look at the association with age, then you can see that some of the tests are associated with age, some like upset smell test, the MoCA, the motor skills like the Purdue pegboard and UPDRS, which were not surprising. And if we look at the association with family history, patients with family history of Parkinson's disease have do less well in the executive function and visual spatial and the global cognitive score in the neurotracts testing. But if we look at the associations with the GBA variant, we see that our cohort, we did not really find any differences. So maybe it's due to the overrepresentation of the N370S mutation or due to overrepresentation of carriers with family history of Parkinson's disease. This heat map shows the correlations between the different tests. And as you can see, some of the tests from the same categories are correlated and also between different categories. Our latest contribution to the literature was presented or published 8 months ago in the International Journal of Molecular Sciences, which shows the 98 carriers that I have just shown you the results for. So what are our future plans? First of all, we would like to test a larger cohort, including non-GBA1 carriers, to enhance the significance of the study. As of now, it is not exactly 207. We have a little bit more, but if we're looking at it, we have a large group of GBA carriers, smaller group of Gaucher patients. We have around 50 controls now and a few Parkinson patients. The next plan is to retest carriers after 2 to 3 years to evaluate the change of risk over time. And the third is to select subjects with the most prodromal features for future interventional studies. And a new addition to our decision on which subjects to select is done by sniffer dogs who are trained to actually smell Parkinson's disease. So I would like to thank our wonderful team at Shaare Zedek Medical Center in Jerusalem and the Gaucher Clinic, our collaborators at Centergene and Arkansas in Germany, and the dogs and trainers in Prognose that have been trained for our purposes. And I want to thank you all for listening.